Let's listen to an expert doctor for hypertension in young population along with coronary artery disease and higher heart rate. Can be sure of happy heart. Today we have Dr. Arpan Goswami, MD Medicine, Bankura Shommiloni Medical College, Bankura. Doctor, how do we define hypertension and when should we conclude that the person has hypertension?
Actually, hypertension by definition is a textbook definition is the lateral pressure exerted by the blood while flowing to the artery. Okay, so this is the hypertension. Now see, hypertension in clinical practice we define in an adult person when the pressure will be more than 140 and 90. 140 is the systolic pressure, that is the upward pressure, and 90 is the diastolic pressure. So if in any condition this pressure is being crossed, so we can design the patient as the hypertension. Now the definition of the hypertension or guideline of the hypertension is changing time to time. According to JNC-8, now it is defined if the systolic pressure is 130 and diastolic pressure is 80, then the person can be defined as he or she is having hypertension.
Doctor, what is the relevance of heart rate in hypertension?
So this is a very relevant in hypertension. Usually we see when the heart rate is high, then the pressure is actually exaggerated. Then, so whenever we are controlling hypertension, we are to be vigilant to actually control the heart rate also. So usually it is actually when the heart rate is high, the pressure may be elevated in certain conditions. In certain conditions, heart rate may be high, then pressure may be low. In certain other conditions, heart rate may be low, the pressure may be high.
Doctor, what precautions should a patient take along with medication?
The first thing we should do in a hypertensive patient, or we advise the hypertensive patient, is a lifestyle modification. Okay, what is lifestyle modification? So first you will have to reduce your weight. At least 10% of the weight should be reduced. Okay, and it should not be overweight. The BMI should be appropriate for your age. At the same time, you should restrict the extra salt. Shouldn't eat the too many things that is creating problem, and that is actually associated with the high cholesterol level in the high oily food. Okay, next is the person with hypertension should be avoid any type of addiction, starting from the taking alcohol to the smoking and all these things, and chewing tobacco. So all these things have to be prohibited with regular exercise. So these together, this package is called the lifestyle modification. The person has to be appropriate for age according to the height. He or she should have no addiction. At the same time, he should do some sort of regular exercise in the form of walking or in the form of mild to moderate exercise according to his age and capability.
Thank you, doctor, for your time.